Hi, I'm Kelly, the inpatient diabetes educator. I'm going to show you how to use an insulin pen needle. First, you want to wash your hands with soap and water. Then we're going to prepare the pen by taking off the cap, and we're going to put a pen needle on the end. So the pen needles typically come with a tab on them, so you're going to pull the tab off, and then you're just going to twist it on the end of the pen. You're going to take off, there's two caps. There's a big cap and a little cap to expose the needle. Then we're going to do a safety check. You're going to dial the pen to 2, and then you're going to push up on the pen. You want to make sure you see liquid come out. We're priming the pen and getting the air out. Once you see the liquid, you can move on to the next step. If you don't see liquid, do 2 again until you see the liquid. Now that we saw the liquid, we can move on to the next step. So we're going to dial up our dose that the doctor ordered. So if it's 8 units, you would dial the pen to 8. Then you're going to wipe off your skin with an alcohol wipe. You want to make sure that you let the alcohol dry. When we give an injection on wet skin, that can cause it to burn. So you want to make sure that you let it dry all the way before you insert the pen needle. So insert the pen needle, then you're going to push down on the top of the pen. Once you've pushed down all the way, you're going to count to 10 before you take the needle out. That's just so that your body can absorb all the insulin. If you take it out too soon, you might see a little bit of insulin come out of your skin. If that happens, you want to make sure that you count slower or just hold it for a little bit longer the next time. That's all there is to it. So then you want to put your big cap on the top so you don't poke yourself when you twist it off. Then you want to take the pen needle off. We use a new pen needle each time. Pen needles do not go in the trash, but they can go in any plastic container with a screw-on lid. So like a water bottle, a detergent bottle, a coffee container, juice container, and then they can go in the trash once they're in that container. Then you put your cap back on, and you're ready for your next injection. I wanted to talk about 2 other things. One about where can you give your insulin shot. Insulin shots can be given in the tummy, in the upper arm, or the thighs. You do want to make sure that you rotate where you give it. If we give insulin in the same spot, it can cause knots, and then the insulin won't work as well. And then storage of insulin. When you pick up your insulin from the pharmacy, you want to originally store it in the refrigerator. Storing it in the refrigerator when it's unopened will allow it to stay good until the expiration date on the box. Once you open a pen, then it's only good for 28 days. So as a reminder, you might want to put the date on your pen so that you know that it's good for 28 days. Once the pen is opened, it does not need to be stored in the refrigerator, but you can store it in there if you want to. All unopened pens need to stay in the refrigerator until you're ready to use them. Thank you.